Hi, everyone. I want to tell you all a story about my friend Aaron. It was the summer of 2015, and Aaron was with his buddies at Kitsilano Beach. He's this super athletic guy, and he decided to do a backflip in the field area. Unfortunately, Aaron landed on his neck, and since then, he has been paralyzed from the neck down. Aaron suffered a spinal cord injury, and for many patients like Aaron, they are immediately rushed to the hospital. Doctors then follow the current clinical guidelines for spinal cord injury patients, which recommend increasing a patient's blood pressure. And they do this continuously for 1 week. This is done in an attempt to increase oxygen to the spinal cord because after injury, there is a lack of oxygen at the injury site, which further worsens the damage. However, doctors right now have no way of monitoring how the spinal cord responds to this increased blood pressure and whether there's actually more oxygen being delivered. This makes the clinical care for spinal cord injury patients very challenging and limited for doctors. To address this need, we developed a sensor that uses near infrared spectroscopy, or NIRS, to monitor real time physiologic responses in the spinal cord. NIRS is a non-invasive technology that uses near-infrared light to measure oxygen levels in the tissue. Essentially, it's a more complex version of your Apple or Fitbit smartwatch that gives you information about your heart rate, but here we're looking at oxygen. For my thesis, we looked at whether this NIR sensor can actually monitor oxygen levels in the spinal cord continuously for 1 week after spinal cord injury in pigs. We compared measurements from our NIR sensor that sits on top of the spinal cord to the current standard in animals, which are invasive probes inserted directly into the spinal cord. We found that our NIR sensor was able to measure oxygen levels in the spinal cord just like the gold standard invasive probes, and the measurements were significantly correlated. From these results, we see that our NIR sensor has the potential to monitor oxygen levels in the spinal cord during the first week after injury. We are encouraged to push forward and now working towards testing this NIR sensor in a clinical trial. Our end goal is to develop a tool to help doctors improve the care for those who have suffered a spinal cord injury, like my friend Aaron, and ultimately improve their chances of recovery. Thank you.